Hello everybody, my name is Jodi Lyons and I'm your host of Your Need to Know. Today I am absolutely thrilled to have as a guest my dear friend Ting Shi, CEO of ClickMedix. And today we're going to be talking about healthcare and technology, particularly artificial intelligence. So Ting, I'm so glad you're here. Thanks for coming.
Thank you so much for having me.
My first question is, can you tell us all a little bit about ClickMedix and what it is and how it started? I want you to brag about yourself a little bit.
Sure. ClickMedix started when I was a graduate student at MIT. It came out of a class called Development Ventures, and our only assignment was simply stated as create a business that will impact over 1 billion people.
Billion with a B.
Billion with a B. Okay. So, and rewind back to 2007. We didn't have an iPhone, we didn't have Androids, we didn't have smartphones. We're still on the flip phones, Kit Kats, or however you call those.
Yep.
Those were the phones. And we thought most people in the world have access to a mobile phone of any sort, even before they have electricity or clean water.
Okay.
If we were trying to tackle and provide healthcare to billions of people, it has to be something they have easy access to, which was the mobile phone. So we started.
Makes sense. Okay.
Yeah. So we started by figuring out where is there a lot of need and where is it so hard that the only thing they have is a mobile phone to access healthcare. So we started our pilots in Sub-Saharan Africa, in Botswana, the Middle East, and Egypt to see, can we just drop in a phone? We programmed the phone, of course, and the phone itself has a questionnaire that mimics how a doctor and expert in the US would have asked the patient about their condition.
Oh, so almost like an intake form for a doctor, except the phone did it.
The phone did it, and we trained the health workers to use the phones and carry out those questioning. And the information, so the intake information then goes back to either a remote doctor or an in-country doctor.
That's amazing. That is absolutely amazing. And so you did that for particular diseases or population health or what?
We started with dermatology because it was so visual. In Sub-Saharan Africa, many places we worked in, they didn't have any dermatologists. We partnered with UPenn, and we had one dermatologist resident on a rotation basis on loan to the country of Botswana. And that's where we started going to villages in Botswana, having the nurse health worker capture the information, the data gets sent to the doctor in the capital of Botswana, and they're writing back on the diagnosis that they think it is. And then they're also instructing the health worker and nurses to provide the treatment, and there's the local doctors to monitor over time.
So that's like early telemedicine.
That is
fascinating.
Early, exactly. And telemedicine is typically perceived as including video. Telemedicine was trialed in those countries, but it didn't work because they didn't have internet infrastructure that's strong enough for a video call. So we did what's called formerly store and forward, whereby you capture the information and then you upload it whenever there is any connectivity. But what was fascinating is when we did this, we realized the nurses are getting trained because every time they submit something, they got a response from a doctor remotely. And the next time they see another skin lesion, they're like, oh, I know this one is psoriasis or asthma or some other issues.
So it ended up being educational in addition to screening or diagnosis.
Yeah.
And telemedicine without an infrastructure. It still worked.
Exactly.
That's amazing. So can we fast forward a little bit?
Sure.
I know you've won numerous international awards for your work, and you never brag about them. But I will say people should Google you and find out what your awards are. But moving forward through these awards, can you tell us why and how you've won some of these awards? Like, Obviously, the work is phenomenal, but brag a little bit about it.
Sure. The first award we ever won was as part of that class assignment. We entered our what we call executive summary of the business plan to the MIT 100K competition, and we won.
Excellent.
Although it was only 30,000 instead of the 100K. But we won that first amount of money that allowed us to pilot, to demonstrate, to prove it out, to go and pilot in about 5 countries in Sub-Saharan Africa and Middle East. And then I applied for the Cartier Women's Initiative Award and won that.
Yes, congratulations, I remember that.
Yeah, and then I won the Maryland's Governor's Cup for startup. And that really helped fund a lot of what we do in the company. And we've always been very cash efficient, and we have been building based on revenues from our clients, and these awards really help pave the way to build the foundation technology as we grew.
Outstanding. And so now let's move forward to today, because obviously we now know you have a background, you are an award winner, you understand health. Now, can we pivot a little to some of the different aspects of health that people don't always think about? So people usually think about doctor.
Yeah.
They think about, in these days, a Zoom call with their doctor due to COVID. But there's also parts of the healthcare infrastructure people don't think about, like payers, insurance companies, things like that. How does that kind of health IT work?
Yeah, so a bit about, I would say, expansion story. So we started in dermatology, then there came need for chronic diseases such as diabetes, hypertension, heart disease, number of diseases. So we use the same model whereby there's an expert that really knows how to treat, manage, screen for these diseases. Then we create a number of screening protocols or questionnaires or intake forms, however you want to call it, deployed it with thousands of health workers and nurses that are on the front line. And we just expanded it from dermatology, I mentioned diabetes, heart disease, kidney disease, dementia, you name it, we've done it. And fast forward to very recent painful history of COVID, we were really forced to look internally as to what could we do in the US. Obviously there's an aging population that's certainly getting sicker.
Right.
And we partner with insurance company to look at their entire population. We use AI to try to pinpoint which of these patients might have a high chance of being admitted to a hospital. So some obvious logical reasons, maybe if someone fell, well, if they went home and they haven't improved their house for safety, they'll probably fall again.
Right.
Or maybe there are underlying cognitive issues that's just going to cause the person to lose balance and fall. So we identify these potential risk factors, and then we make a prediction and a score for how likely will that person be admitted to the hospital. And also after they get discharged, will they be readmitted? So we work on pinpointing the population to help payers identify which ones need more intervention, more hand-holding to make sure that person doesn't get admitted again. And we also empower the nurses in the US, just like we did everywhere else in the world, to do the intake, to then communicate that with the best of evidence-based protocols, as if a specialist or expert doctor was supervising the work.
So in the US, if I'm understanding this correctly, you're doing the same thing you were doing overseas, which is identify the patient population, mimic what the expert would be doing for intake questionnaires, evaluations, etc., gathering the data, and then basically using artificial intelligence to analyze that data and then come out with actions for humans to do. Is that pretty much a safe bet?
Yes, and adding on to it, with every new piece of information, for example, we were talking about someone who fell, then the nurse went there and did a mini mental, identify their underlying cognitive issue. Then with that new piece of information, that risk score has just gone higher. Then we inform the nurse, have you considered this risk level? Make sure you do mental health or dementia prevention protocols. to prevent that from happening. So it's
Okay.
learning.
It's learning, which
Yes.
brings me to my next point. I know we tossed out the word artificial intelligence, and we've been using the word technology. Can we start at the very beginning of what is artificial intelligence? What does it mean? That word, that phrase, what does it mean and what does it do?
So it's fascinating. The first time I was learning about artificial intelligence was while I was at college
Okay.
at Carnegie Mellon. So dating myself here 20 years ago.
Yeah.
And we were essentially programming to see, let's say this is an orange.
Mm-hmm.
And I'm telling the computer this picture is an orange.
Okay.
Then I show 20 different pictures of oranges and tell the computer, I'm training the computer, hey, this is an orange, this is an orange, this is also an orange. Then I show some strawberries. This is not an orange, this is not an orange. So different
Okay.
fruits to really train this if you were a toddler.
Okay.
Right? This is the fruit, here's what it calls, and there are a variety of them so that the machine is starting to learn the pattern of what they're looking for. And
Okay.
in reality, the machine's looking at pixels and colors, and some pattern emerge. You know, orange, it's probably orange in color or yellowish hue in color, it's probably round. Starts to take those patterns and start to classify. If I see the data like this, these kind of pixels that that's how the machine sees in color pixels, then it's an orange. And then it can roll out a whole list of other fruits. Oh yeah, it's not red, it's probably not a strawberry, and so on and so forth. But you could start training it and say, this is a genetically engineered orange, is way bigger, but it's still got similar characteristics. Then it starts to learn and include that new variation into its interpretation or identification of something like an orange.
Okay, that is really cool. So when people are talking about artificial intelligence and things and machines, I mean things being non-human machines, learning, that's what we mean. That's artificial intelligence, and it's learning from different data inputs to become quote unquote smarter.
I think at the core, yes, but what machine does that's better than humans is they can take on thousands, tens, millions of input. If I were to teach you here 10 million oranges, at some point you're going to go, that's too much information.
And we get information overload, but the machine, in theory,
they can
has a lot
analyze
more,
unlimited amounts of data, and with how fast technology has improved, everything is faster and cheaper. And that's why we couldn't do it 20 years ago, because it's just really expensive, take a long time.
Now that makes sense, and now we can. Well, we're heading into our break right now, and please hold on, because we're going to come back in just a moment.
Caitlin, be serious. No, take the oath. Come on. I'm totally taking this seriously. Okay, I'm ready. You may begin. I pledge that I will never meet in person with anyone I first met online without checking with my parent or guardian. And furthermore, if my parent or guardian agrees to the meeting, it will be in a public place and my parent or guardian must come along. Do you pinky swear? I do.
When you teach your kids about internet safety, they'll pass it on. For more information, go to cableclicksmart.org.
STEM is the discipline of hard numbers, precise, no margin for error.
Dare to forget that. Dare to have fun with it. Get weird with it. Dare to get messy, or just mess it up. Dare to program something internet-breaking, record-breaking. Dare to blow their minds. Dare to try. Dare to fail. Dare to keep daring. Science! Dare to learn the difference between organic, sedimentary, and non-foliated metamorphic rock. Get outside. Find those rocks. Dare to be homeroom famous, a high school fable. Dare to send those old STEM theories flying past the neighbor's house into outer space. And for the love of STEM, dare bigger. Dare to code. Dare to invent. Dare to explore. Dare to STEM. Check out She Can STEM to get started.
What are you looking for?
Hi everybody, welcome back to Your Need to Know. I'm Jodi Lyons and my guest today is Ting Shi. And before we left for the break, we were talking about one type of artificial intelligence, which was basically teaching the computer to learn something like this is an orange, and that was visual and involving pixels, etc. So Ting, can you explain this for other types of artificial intelligence? We already did the visual input. Can you explain another type?
Sure. I'm sure you've all heard of ChatGPT.
Yes, yes.
Which, so similar to what we talked about, it has been trained essentially to read the internet.
Okay.
It has read, except for all the way up to 2021, if you ask for anything more current, like what happened yesterday, what was the top bank failure in,
yes.
in 2023, it will not know that because it hasn't gone and learned it.
Okay.
So ChatGPT, because of the way you interact with it, you essentially talk to it like it would a person, your executive admin person.
Okay.
It does what we call natural language processing AI.
Natural language processing. Okay, that's a different type of AI than we were talking about before.
It's similar in its core, whereby
Okay.
you train it in a language. So in every language, in this case English, we've got grammar, we've got phrasal templates for how you would put together a sentence. So
Right.
it learned English, so it
Okay.
knows how to speak English based on what you tell it.
Okay.
It also learned how to interpret what you want it to do. So for example, you can say, summarize a book and as if I'm a 5-year-old.
Okay.
Then it understands how to summarize it, but then change it to English vocabulary that a 5-year-old can understand.
Okay, and that's natural language processing, and its purpose basically is to communicate ideas and things like that.
Right. After it's learned to read,
Okay. Okay.
and it read the entire internet, and hence you can ask it questions. And we get asked this a lot too, how does it differ than, say, Google search?
Yes,
Well,
that was going to be my question. So what is it doing that's different than what I'm already doing when I search?
Yeah, so for example, if you want to say, I have a banana, kiwi, and pork in my fridge, I want a recipe. You might type those in to Google and you're going to get lots and lots of search results. You have to click on each one. You got to select, okay, I like this one, I don't like this one. In ChatGPT, it would say, here's one recipe that you might like. And then you can have a conversation and follow it on with, I'm Asian, I would like Asian cuisine. Here's an Asian cuisine. Or you say, I want some options. Give me 3 options, that's Asian cuisine with these recipe. And
Oh, interesting.
yeah, and it starts to, it's really like a conversation. And that's
So
what's,
it's basically reading the internet and summarizing it for you, kind of like a good old-fashioned book report.
yeah, but it's able to select for you too based on your preferences.
That's amazing. So now, if we were to follow that same thought of artificial intelligence learning things from humans and then teaching humans, how would we apply this to healthcare?
Well, it's fascinating. While we work on population health with U.S. health insurance, particularly the senior population Medicare Advantage plans, while we have data on this person is sick with these diagnoses, and we can pinpoint which ones have potential high risk of being admitted, as we discussed earlier, what we can also do is what we call unsupervised learning, as in, we don't know what's going on with this person. We don't know if they're going to be admitted.
So it's missing that data. It's just, here is a person, what do we do with them?
Right.
Okay, so how does that work?
Yep, so just to make sure we completely get this,
Yes.
instead of saying this is an orange, we don't know what that is. We don't
Okay.
we're not able to train the computer to say what it is definitively.
Okay.
So what we do is, boom, here's millions and millions of data, and we do have description, this person's age, we do have some diseases, we do have some history for whether they were in the hospital or not.
Okay.
And then we ask, after we give it all that mumbo jumbo of information,
Yep.
we say, okay, sort it out and tell me which 10 people might be admitted within a year.
So it's almost like it's learning to establish a pattern out of the bunch of data. So you could have a fruit bowl, for example, and the system might know what a pear is and a banana is and learn from the context? Or
Sort of. So we take a person, a patient,
Yeah.
all of their thousands of fields of data, but the important thing is we want to link it to whether the person will be in the hospital within a year.
Okay.
Then it's going to look in some historical data and some other, it's going to learn what are the patterns that matter. So it's going to say, well, what matters to make this prediction is going to be their diagnosis. So if they have 5 or more chronic disease, one of them being a mental health problem
Yep.
or cognitive disorder, they'll probably end up in a hospital. Or if they are taking a lot of medications, 10 or more, they'll be likely going to the hospital. So it's taking so many
Okay.
data points and distilling it to here are the 5 factors that actually contribute to potentially being admitted to the hospital.
That's amazing. So let's say for a minute, let's put on an insurance company hat for a moment. So the insurance company is using this type of data to figure out if there are patients who need extra supervision, if they need extra nursing assistance, one of those call centers, a home health visit, some action to prevent an unwanted outcome.
Yes, absolutely.
So how would the technology fit in on that? Because
So-
normally, in the old days, we would just have a nurse call up and say, hi, I'm calling from XYZ Insurance, just checking in. We know you have, and they run through, how's diabetes, how's asthma, how's heart disease, how's your eyeball, and discuss that. So how's the artificial intelligence doing that now?
So when we make these analysis out of, let's say 100,000 people population, we find 10,000 of them are at high risk. Then what
Okay.
we also find is they tend to concentrate in certain zip codes. And they are all similar.
Interesting. Okay.
Lack of transportation to see a doctor, too far from a doctor, can't get to a pharmacy. They're all very logical reasons,
Okay.
but we find clusters of them. So then that makes it easier to say, we only had 20 nurses, we are not hiring anymore. Well, 3 of them will focus on these zip codes, and they will address the issues,
Okay.
which is access to the doctor, maybe a telemedicine call, deliver your pharmaceutical so that they don't run out of refills. So it makes it possible to do very efficient interventions.
That makes a lot of sense. So it's basically resource allocation and then using data to identify what the implementable solutions are. It's not just data for data sort.
Exactly.
There is something that can be done, and it's interacting with humans.
Exactly. And remember the part where we are able to deploy nurses and health workers to carry out certain steps that we want them to do in an interview. So then we identify, okay, this population have access to doctor issue. Make sure you ask them about these and make sure you can link them up to remote health. So it starts to inform that intervention. And because we deliver that intervention, we should be able to see a reduction later on that this
in the
person...
hospitalizations.
Exactly.
And so it can also identify the social determinants of health, is what the big word we use, which is, can the person get to the doctor? Do they have food to take with the medicine? Could they get the medicine in the first place? Are they living in a safe environment? And so the humans that are being deployed in to take care of those other humans are then basically reporting back to the artificial intelligence? Or explain that a little more to me.
So the humans, let's say we find cognitive disorder, cognitive is the underlying cause of why some of these people are going to the hospital.
Right, so meaning they're going to the hospital because they couldn't remember how to take their medications.
Right.
Or that they needed to, or
exactly,
other, okay.
Exactly. Then we will instruct the human to do mini mental exam to address that cognitive disorder and try to prevent future falls or a home safety so that they don't end up falling.
And that's, that because there is a nurse or other healthcare worker going in seeing it.
Yes.
Because you can't necessarily rely on the patient to be the correct and accurate reporter of their own condition because of the underlying cognitive impairment.
Exactly.
So you're kind of compensating for a failure of one brain by substituting another brain and artificial intelligence?
I would say yeah. So
Okay.
we've always, we in emerging markets, we call these frontline workers, nurses, eyes and hands of remote experts. So they're
That's
there.
cool. That
they can see, they can
bears
touch.
repeating.
Right.
Eyes and hands of the remote experts.
Yeah.
That's cool.
Yeah.
Okay.
They can see, they can get more accurate data, they can deliver the actual interventions. And the machine in aggregate help provide more intelligence and more recommendation. Ultimately, it is up to the judgment of the trained human to try to deliver the right intervention.
Right, but it's in a way, it's giving the trained human more information to
Right.
work with
Yeah.
than they would before.
Yeah.
So I guess I kind of liken it to, we always tell our clients, if you have a doctor's appointment, please write down your notes before you go into the doctor's office and hand them to the doctor so you don't forget something.
Yeah.
So in effect, it's basically using the doctor's expertise or the other medical professional's expertise, hands and eyes on the patient, intelligence being artificial and human combined,
Yes.
to basically create a human profile, population management even, because it's not just one human, there could be 30 in that same block with the same issue.
Yes, yes, absolutely.
So that's a great way to actually identify things like, you know, there are parts of the US where there are no primary care physicians.
Yes, we even have that down to how many miles is particular individuals away from their primary care doctor and how to supplement that also.
So it also seems like with population health management and things like this, it's a really good way to help figure out where new resources need to be deployed.
Yes.
So that kind of stops using the emergency room as your primary care physician.
Yes, exactly.
I bet the EMTs are real happy with that as well.
Yeah, yeah, and we want to get to the patients before an adverse event, before they need to even go into ER or hospital.
So preventing
Yes.
adverse events when they happen.
Yes.
Well, Ting, I cannot thank you enough. I'm so thrilled that you were here, and I've learned a lot about this. I have to admit I was very, very curious about what natural language processing meant and how it affects the healthcare world that I'm in. So I very much appreciate that. Everybody, thanks again for joining us on Your Need to Know. Once again, I'm your host, Jodi Lyons, and I thank my guest, Ting Shi, CEO of ClickMedics, for being here. Thanks a million. I appreciate it.
Thank you for having me.